Hey y'all, it's Val Emmons here, and we have a lot to talk about. It's November 14th, 2013. Wow, just a month and a half away, and it'll be 2014, folks. Get all you can packed into the rest of this year. So anyway, we got a lot to talk about today, pack in this 30 minutes podcast. But so apparently, the administration finally releases the number of Americans who enrolled in Obamacare, and you can read my blog titled the same on www.valemmons.com. Just launched that today, so there'll be more added to it every day. So go ahead and check that out, and you can also find more podcast links to the show on that page as well. Anyhow. Today, the Obama administration released the numbers on those Americans who have signed up and enrolled on the healthcare exchanges. The interesting thing is the way they were defining who had enrolled via the website. I've been talking about this over the last couple of shows. The administration decided to count those Americans who had went out to the website and placed a policy in their care, regardless of whether, in their cart, regardless of whether or not they purchased the plan or not. This method is very misleading to Americans who don't distinguish the fact that 100,000, how many is this? 106,185 Americans selected health plans in first reporting period of open enrollment. Doesn't mean they purchased them, only that they selected them. My guess is that they saw how expensive the plans were and left the site, as this is what I did just for kicks when the website came out. And so detailing results of the first reported period, October 1st to November 2nd, of the Health Insurance Marketplace's open enrollment, Health and Human Services Secretary Kathleen Sebelius, Cruella I call her, announced today that 106,185 individuals had selected plans from the marketplace, and another 975,407 had made it through the process by applying and receiving an eligibility determination, but have not yet selected a plan. Okay, folks? In addition, they haven't selected a plan, which means they haven't purchased anything yet either. An additional 396,261 have been determined to assess eligible for Medicaid or children's health insurance programs. The promise of quality, affordable coverage is increasingly becoming reality for this first wave of applicants to the health insurance marketplace, Sebelius said. There's no doubt the level of interest is strong. We expect enrollment will grow substantially throughout the next 5 months, mirroring the pattern that Massachusetts experienced. We also expect that the numbers will grow as the website, healthcare.gov, continues to make steady improvements. That thing is like Freddy Krueger, Nightmare on Elm Street. She didn't say that, I did. According to HHS.gov, the following key findings are among many new available data reported today in an issue brief from HHS that highlights national and state level enrollment related information. Okay. Again, 502,466 Americans in just the first month of implementation are positioned to have health care coverage in 2014. Positioned. Of those, 106,185 Americans have selected plans from the state and federal marketplaces. 106,000. They've selected them. They haven't purchased them. 396,261 Americans have been determined or assessed eligible for Medicaid or CHIP. 975,407 people have made it through the process by applying and receiving eligibility determination, but haven't, again, selected a plan. You know, folks, all this is great, except for the fact that 5% of the American population, or 15,400,000 people, just lost their insurance. And now are facing policy increases doubling or tripling their current premium because they can't keep their current health care their current insurance as Obama promised that they could before the elections of 2012. The cancellations have had such an impact that even Democrats are calling for a solution to this problem by Friday from the administration, or they're threatening to back a plan by Representative Fred Upton of Michigan that allows people to keep the policy they like. I talked about this plan yesterday on the show, so you can go back and listen to that one if you want. I got a lot to pack in the show, so I don't want to go over that too much, but it's kind of like putting a Band-Aid on something as well. It's not really going to fix it because it's only going to get worse if we don't repeal this nightmare on Elm Street healthcare swindle. That's what I'm calling it. Today's report includes breakouts of enrollment-related data by state, including each of the 50 states in the District of Columbia. The report groups the states into the Federally Facilitated Marketplace, or FFM, defined as those states where HHS is running the marketplace or states where HHS is doing so in partnership with the state, and state-based marketplaces. SBMs, in some cases, only the partial SBM database was available. In total, 106,185 Americans selected a qualified health plan, QHP, through the marketplace during the first reporting period of open enrollment. Enrollment figures, including those who have selected a plan and have or had not yet paid the first month's premium, of the people who have selected a plan, 79,391, or 74.8%, enrolled through the state-based marketplace, while the other 26,794 people, 25.2%, enrolled through the federally facilitated marketplace. Additionally, 396,261 Americans have been assessed or determined eligible for Medicaid or CHIP. SBMs that provide data for the report accounted for 212,865, or 53.7% of those determinations, while the FFM accountable for 183,396, or 46% of them. Forthcoming data will enumerate those who applied directly to the state Medicaid office. The report characterizes past experiences in health insurance enrollment patterns, noting typical low initial enrollment, and, for example, federal employees, blah, 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 blah. So basically what they're trying to compare this, and they're trying to say it's not that bad, really. It's not that bad, because these were low to begin with, too. The report also addresses marketplace customer service, outreach, and web traffic. If you're interested in this, you can go to the HHS.gov website, or you can go to my page, and all the links are there. You can go to www.valemmons.com. So, I told you yesterday that I was going to lay this out for you. There's these things called essential health benefits. And this is why people are losing their insurance right now. Because the insurance that they had doesn't cover the 10 essential benefits that Kathleen Sebelius set forth after the Patient Protection and Affordable Care Act passed, and Congress also approved these. Not all of Congress voted for these, but it passed, so they approved it. And basically, this is what she considers to be an acceptable insurance package, okay? So, this is from healthcare.gov, and you can find it, Essential Health Benefits. A set of healthcare service categories that must be covered by certain plans, starting in 2014. The Affordable Care Act ensures health plans offered in an individual and small group markets, both inside and outside of the healthcare insurance marketplace, offer a comprehensive package of items and services, known as essential health benefits. Essential health benefits must include items and services within at least the 10 of the following categories, okay? Number 1, ambulatory patient services. Number 2, emergency services. Number 3, hospitalization. And number 4, maternity and newborn care. Now let's stop right there. This is what I've been telling you about. Maternity and newborn care. Okay? If you're a man, you have to have maternity and newborn care in your policy, or you'll be fined come tax time. If you are 18 years old and going to college and don't plan on having any kids, then you have to have maternity and newborn care, regardless if you're a male or a female, okay? If you've had your tubes tied and you're a female, you have to have maternity and newborn care. This is ridiculous, and this should have been corrected. This should not have been allowed to pass. This is absolutely ridiculous. If you are fixed, if you're a man and you're fixed, you can't have a baby because this is ridiculous. Maternity and newborn care. All right, that's number 4. Number 5, mental health and substance abuse disorder services. Number 6, including behavioral health treatment. Number 7, prescription drugs. Number 8, rehabilitative and habilitative services and devices. Number 9, laboratory services, preventative and wellness service, and chronic disease management. And number 10, pediatric services, including oral and vision care. So if you're 50 years old, not yet the age to qualify for Medicare and Medicaid, you have to take coverage for kids to cover your children. Even though you're probably not going to have any more children. You have to have these services if you're 18 years old and have no children. You have to pay just like someone who has children. Okay? This is ridiculous. This is why insurance companies are canceling policies. Because of these stupid things that are set forth for every policy that you have to have it or you be fined. So if your insurance company is allowing you to keep your insurance that you've had, and you don't have maternity if you're male, and you don't have this or that for pediatric services if you're 80 years old, you will still get fined. You will still get fined. So insurance companies are just dropping these programs altogether because they know that you're going to get fined. Insurance policies must cover these benefits in order to be certified and offered in the health insurance marketplace. States expanding their Medicaid programs must provide these benefits to people newly eligible for Medicaid. This is just getting better, folks, because I came across a story today on campusreform.org. Public college cites high cost of Obamacare and canceling students' health plans. Bowie State, some facts right here, is among the oldest and most elite historically black colleges in the nation. Student health insurance costs will rise from $50 to $900 a semester. The White House says it has a bias in favor of historically black colleges and universities. Okay? Those are the little bullet points they were pointing out. So I'm going to read some of the story to you because this is another aspect of this. Students are required to carry, male students, again, like I said, are required to carry maternity. So if they get knocked up at a frat party, they'll have coverage. Officials at one of the nation's oldest and most elite historical black colleges are citing the Affordable Care Act as the reason they have canceled a school-wide affordable health care plan they had offered students. The official website for Bowie State, a Maryland public school less than an hour's drive from Washington, D.C., explains that Obamacare's new regulations would force the cost of insurance to rise from $50 to $900 a semester. Bowie State University has suspended offering health insurance for domestic students for the 2013-14 academic year. This is on the school's website. You can check that out at www.campusreform.org. And let's see. Due to the new requirements of the Affordable Care Act, which will go into effect on January 1st, 2014, the cost of insurance for domestic students will increase to approximately $1,800 a year. That works out to approximately $900 a semester. The student's health insurance plan had cost students $50 per semester in 2012-13 school year, according to a cash aid page to the university's description of the plan. The original link to the description has been deleted. According to an article in the Bulldog Collegian, Bowie State official student newspaper, the director of the Bowie State University Wellness Center said that the university decided it would not be worth it to provide student health insurance at all, given how expensive it would be to do so under the new regulations. Wise thing, Obama. This is great for all Americans, especially students who eat ramen noodles. Anyway, the student's article published November 10th had slightly different numbers than the school's website. It states that the student's health plan used to cost $54 a semester, not $50, and that the new insurance cost would be about $1,900 a year, not $1,800. In August of this year, White House Principal Deputy Press Secretary Josh Earnest suggested that President Obama would lend special support to the country's historical black colleges and universities. The president and his administration have been strong supporters of historically black colleges and universities all across the country, said Earnest, speaking from the White House on August 20th. Funding for those colleges and universities has increased under President Obama. The president's record on these issues, he has a bias in favor of historically black colleges and universities because of the service they provide and because of the quality education they provide to their students. Bowie State Wellness Center did not respond to requests for comment from Campus Reform in time for the publication of this article. Several other colleges and universities, such as community colleges in New Jersey, have also had to cancel student health insurance plans because of Obamacare. All right, now this is getting so bad, this cancellation of these policies, that White House officials are now threatening, like I reported on my blog, they're threatening, and they're saying we're gonna back this Republican bill to fix it if you don't do something about it. So apparently, the administration, according to CNN, a private meeting on Capitol Hill with House Democrats and White House officials on Wednesday became heated when rank-and-file members expressed frustration about continued Obamacare problems, according to the multiple sources that were in the room. One congressional Democrat who attended the meeting said senior Obama administration officials Mike Hash and David Seamus really got hit by House Democrats about everything from the troubled website to the broken promise that people can keep the insurance plans they like. The most pressing political challenge for House Democrats will come Friday, when they will have to vote on a House Republican plan by Fred Upton of Michigan that allows people to keep the policy they like. Several lawmakers, even liberals who adamantly support Obamacare, stood and warned the officials that the White House must come up with a solution before the vote. And then yesterday, of course, you know that former President Clinton gave an interview on OIS.com stating that the president should stick to what he said and his promise about allowing people to keep their health insurance that they want, the coverage that they want and they had. Members want to keep their promises to their constituents, which is that they would have affordable insurance. If they want to keep their plan they have, they would keep it, said Representative Marcy Kaptur of Ohio, a Democrat. We would offer broader insurance alternatives so that people would have more competitive pricing. Democratic congressional sources have told CNN that Friday is the de facto deadline for the administration to come up with a fix. So he's got till Friday to come up with a fix to this problem. And I don't think it's going to happen. I don't know what exactly they think they're going to do by Friday, unless Sebelius reverses her regulations that require that, 18-year-olds, males, have maternity coverage and pediatric coverage for their children that they don't have. I mean, if you're a man and you're fixed, if you're an older gentleman, you have your tubes tied as well, or mastectomy, that they call it, you still have to have coverage for kids. That's stupid. Anyway, they were talking about the ultimate impact of voting for it. The fact that it would allow plans that had high deductibles, very poor coverage, which of course we want to get rid of. This is the administration came to a meeting to try to convince House Democrats not to vote for the Upton bill, saying that it would gum up the system and result in higher premiums for most Americans. How can you be any higher than what they are now? Anyway, Democratic Representative Jose Serrano of New York told reporters he thinks something will develop over the next 24 years. I mean hours. I'm thinking years. That was like a Freudian slip. I'm thinking 24 years. The White House spokesman Jay Carney said, "You can expect the Obama administration to announce plans for addressing health policy cancellations under Obamacare sooner rather than later." Carney said President Barack Obama has asked his team to come up with the policy options, suggesting they were moving quickly. Really quickly? Okay. I'll believe that when I see it. He again rejected the Upton bill as not an effective fix because it opens up the plans to anyone, not just the people whose plans are being canceled. Lawmakers also expressed frustration with the healthcare.gov website, the chief portal for people who want to sign up Obamacare through the federal government. Its October 1st launch was a debacle, like I'm going to call it, Nightmare on Healthcare Street. That's my new phrase. That's it, guys. I figured it out. Nightmare on Healthcare Street. That's what it is. All right, we're going to put that on my blog. Anywho, let's move on to something else because I'm really sick of talking about this. Instead, I want to talk about Mark Pryor. Mark Pryor seems to have a new ad out today. If you don't know, I know this is a national broadcasting platform. So, Mark Pryor came out with a new ad, and I'm going to get to it here in just a second. But anyway, he's trying to shift the fact that he voted for, the nail in the coffin for Obamacare. He's trying to shift that and say that, actually it's not shifting, he's trying to go back and say that Tom Cotton, who is his opponent, he's trying to go back and say that Tom Cotton voted 70 different times. That's the name of the commercial. It's 70. 70 different times, or I'm sorry, the age requirement for Social Security that Tom Cotton is supporting, which he is. He did support that. So I'm not happy with either of these candidates. But anyway, Mark Pryor is one of the least ones that I'm happy with. I want you to listen to this ad right. Let me get this mute off.
Some politicians like Tom Cotton voted to cut Social Security.
Should Social Security be privatized?
Turn Medicare into a voucher system.
Contributions sort of voucher system.
And raise the age of eligibility to 70.
Medicare would hurt seniors, not Mark Pryor.
Mark's working to make Social Security and Medicare stronger.
By cutting billions in waste.
More doctor visits.
Free preventive care.
And lower prescription costs.
I'm Mark Pryor. I sponsor this message because cutting waste and fraud is responsible. Cutting benefits isn't.
Anyway, so he's attacking his Republican challenger, Tom Cotton, over Medicare and Social Security, the tactic likely to be adopted by other Democrats. The National Journal reports in an article titled, "Under Fire Over Obamacare, Arkansas Senator Changes the Subject." Squeezed by Obamacare and an unpopular president, Senator Mark Pryor is turning to the Democratic Party's most tried and true talking points in his fight to win a re-election: Medicare and Social Security. We'll see how this goes out. I did a commercial against Mark Pryor. My whole 10 minutes of fame was, he voted for Obamacare, in the Senate conservative ad that came out over the summer. But I'll have to put that on my blog too, because I thought it was a fantastic little line I had. Now, it was a really good commercial. I think it hit the message that we all wanted to send about Obamacare. Speaking about Obama, apparently the Syrian ELectronic Army, who hacked into a couple of his, I think it was accounts last month, Monday appeared to have hijacked President Barack Obama's official Twitter and Facebook accounts again, and claimed that they successfully broke into several of his campaign email accounts. And you can see them on, go to my Facebook page, www.facebook.com/Val Emmons, and this is, scroll down and it's in there. It's very interesting because you can actually read the emails. Like, you know how Gmail, it's a Gmail account, but you can actually read, like, the first line of the email, and some of it's kind of cool. I wish I could see all of it. But, anyway, let's see. Obama doesn't have any ethical issues with spying on the world. I think they're talking about NSA here, I would safe to say. So we took it upon ourselves to return the favor, hacking group Syrian ELectronic Army said. This is reported in The Blaze. Anyway, for a brief period of time, Monday afternoon, shortened links from Obama's Twitter and Facebook accounts redirected users to a pro-Syrian video. As a result, Twitter started warning users that links from Obama's Twitter account may be unsafe to visit. Thanks to our operation, Twitter now blocks Obama's dangerous propaganda links, the hacking group gloated in a tweet. They also claimed on Twitter that they were able to hack into Obama's campaign email accounts and posted on Twitter with a screenshot appearing to show access to one of his compromised accounts. The account depicted in the screenshot appears to belong to Suzanne Snurpus, a state climate organizer for Organizing for Action, Obama's political campaign arm. We accessed many Obama campaign emails accounts to assess his terrorism capabilities, the Syrian ELectronic Army said. They are quite high. That's their assessment. Because, you know, that's what they say they need the NSA to monitor our emails for, is because to see our terrorism capabilities. Another screenshot posted by the hacking group appeared to show that they had gained access to a control panel providing access to fundraising pages and contributions. The White House did not immediately respond to the Blaze's request for comment Monday afternoon. On Sunday, the same group also appeared to have compromised a page on Obama's website. The Syrian ELectronic Army is a hacking group famous for supporting Syrian President Bashar al-Assad. In August, the group defaced the New York Post Facebook page and multiple prominent Twitter accounts. This is the developing news story, so you can keep updated on that on The Blaze, and of course I'll keep you updated on it because I like to follow stories about this, because it goes to the NSA. It goes back to the NSA. And the HuffPost wrote an article today called NSA Chilling Effect Feared by Writers, which is true. If you're scared, like I'm not scared, I'm not politically correct, I don't care. You know, come arrest me. I'll do my time because that's what I do. I am a thinker. I'm a free thinker. I am free, and I use my freedom of speech. And having the NSA watch over a person who is a reporter, who is charged with being a watchdog over the government, is not how things are supposed to be, because it stifles what they might say for fear that people are listening. American writers are increasingly fearful of government surveillance in the wake of Edward Snowden's revelations about the National Security Agency, and have even started to self-censor their work. A survey released by the writers group PEN on Tuesday found 85% of PEN's American members are worried about government surveillance. The group's report found PEN is best known for standing up for the rights of writers internationally, championing imprisoned Nigerian playwright Wole Soyinka in the 1960s and Salman Rushdie when he was threatened with the death of his book, The Satanic Verses. We have long known that aggressive surveillance regimes in places like the Soviet bloc, China, Iran, and elsewhere have cramped discourse and narrowed the flow of information and ideas. Suzanne Nossel, executive director of PEN American Center, said in a statement, recently disclosed U.S. surveillance practices are having a tangible and chilling effect on writers here. 28% of PEN's members have curbed their social media use, 24% are avoiding certain topics in phone and email conversations, and 16% have avoided writing or speaking about issues, the survey found. Now, those concerns are coming home to America, PEN said. The report said writers are well aware of the NSA's surveillance practices, like logging records of every American phone call and accessing the servers of major internet companies. Many now assume their government is listening, and it will. Writers reported being fearful about discussing military affairs, the Middle East, North African region, mass incarceration, drug policies, pornography, the Occupy movement, the study of certain languages, and criticism of the U.S. government. That last one just blows me away. Criticism of the United States government. I'm here to tell you, I'm going to criticize. I'm going to criticize the right. I'm going to criticize the left. And there is nothing anyone's going to do about it. You can put me in prison. I'll still criticize. I will still criticize. You can listen to me all you want. I will still criticize because that is my right as an American. And you cannot take that away from me, President Obama. I'm so irritated with this NSA stuff. It's gone out. It's out of control. It really is out of control. And if we don't get out and do something about this, we've got to get up off our keyboards and do more about it. Protest the NSA more. I think it's absolutely telling that our society, that we are much more, we're so comfortable that we just get on Facebook and this has got to stop. But what does mashing on your keyboard really do? Now, I'm not inciting violence. What you do is on you. I'm saying people need to get out there and make your statement. And don't be afraid of what the government says. Don't be afraid that you're going to get overheard by the NSA. Because the way I look at it, they're probably inadequate when they're sitting there looking. Anyone else they hire in the government is inadequate. They're probably sleeping on the job there too. So, anyway, that's about all I have for the show this afternoon. Don't forget to go out and check out my, this evening, I'm sorry. I like to do the show at the end of the day now, guys, because I think that all the information comes along by the end of the day. That way I can give you updates on everything. And I hope you are liking this model that I'm using. If you don't, or if you do, go ahead and leave me some feedback on my Facebook page, www.facebook.com/Val Emmons. That's VALEMMONS. And you can check out my new blog. It'll be getting better, I promise. It'll be filled with content you won't even be able to read it, because I have ADHD. I always have to find something new. Anywho, so that is ValEmmons.com. Easy enough to remember, VALEMMONS.com. Until tomorrow night, I'll be seeing you.